This diagram illustrates a massive workforce operating quietly across the United States. Currently, about 63 million Americans, 1 in every 4 adults, provide unpaid care for a loved one. Most of these individuals do not call themselves caregivers. They describe their labor as just helping out, or just making sure mom gets what she needs. But over months and years, that informal assistance compounds into a demanding, invisible second job that dictates the rhythm of daily life. One of the most time-consuming and physically taxing parts of this hidden job is the responsibility of driving a loved one to medical appointments. Calling these trips a simple favor masks the logistical weight of the task, leaving ordinary families to navigate a complex medical necessity on their own. Every medical appointment requires a sequence of high-stakes physical and mental maneuvers. The process begins long before the car leaves the driveway. A caregiver must assist with dressing, manage a transfer from a bed to a chair, and guide their loved one across uneven sidewalks or downstairs. This anatomical model compares the mechanics of an awkward physical transfer to the human spine's safe lifting capacity. Without professional training, a family member attempting to lift an adult into a standard vehicle frequently exceeds these safety limits, risking injury to both parties. As the timeline expands, you can see the secondary stressors. The physical strain of the loading process is immediately followed by the mental toll of navigating traffic, managing passenger anxiety, and the pressure of missing hours at work. The process concludes with the final gauntlet: finding accessible parking, unloading heavy mobility equipment, and navigating facility hallways. This single appointment has now consumed several hours of active, strenuous labor. Families perform these tasks out of love. However, affection alone cannot change the physical weight of a wheelchair or the fixed hours of a workday. Relying on love to solve these complex logistical problems eventually pushes the family unit toward a physical and emotional breaking point. When the logistical burden is this high, why do so many families hesitate to ask for help? The barrier is a specific psychological trap known as caregiver guilt. It convinces family members that hiring professional transportation is a sign of failure or a step toward abandonment. This guilt leads to very real, tangible consequences: acute back injuries for the driver, disciplinary issues at work, and the steady depletion of household income. Managing every detail alone creates a cycle of exhaustion that ultimately harms the patient through missed appointments and inconsistent care. Non-emergency medical transportation, or NEMT, provides a targeted infrastructural solution to this specific failure point. This chart divides the transit landscape. Ambulances handle crises, and rideshares provide basic transit. NEMT offers supported medical transit for stable passengers needing physical assistance. The mechanics focus on safety, utilizing hydraulic lifts and drivers trained in physical transfers, wheelchair securement, and medical patients. Because this support is a healthcare necessity, it is often integrated with Medicaid and other insurance programs to ensure patients never lose access to their doctors. By utilizing this infrastructure, the family stays in control of the care plan without having to perform the dangerous physical labor of the drive itself. NEMT provides the logistical infrastructure that allows family caregiving to remain sustainable over the long term. Outsourcing the logistics of the ride is an act of building a more resilient care plan for the entire family. Patients often stop feeling like a physical burden on their families once the most grueling parts of the trip are handled by professionals. For the caregiver, the state of constant logistical panic is replaced by a reliable, structured routine. Removing the exhaustion of lifting and the stress of traffic creates space for true emotional presence. The caregiver can focus on listening to their loved one and advocating for their health. When the logistics are managed by a professional team, a daughter is finally free to simply be a daughter again.